So in everything you do, you have to compare the risk and the benefits. Does the benefit of getting the vaccine outweigh the risk? And that's a personal
getting COVID.
Yeah, and you have to decide, and we're talking about facts. But there were several other questions that you sent us on Instagram that we wanted to address. And are the reports of Bell's palsy side effects true? And
That's
we
true.
said yes, that is definitely one of those true. Since the vaccines are from different companies, do they all have the same ingredients? And we've talked about that in that there are some subtle differences. The big component though is messenger RNA.
Yeah,
and yeah. And so the preservatives are different. There are some subtle differences, but they work very similarly in that you get an immune response from it. Pfizer has 30 micrograms of the vaccine. Moderna has 100 micrograms of the vaccine. Pfizer is 21 days apart for the two shots. Moderna is 28 days apart for the two shots. So again, there are some subtle differences, but the end results will be the same.
That you're trying not to have, even if you do get exposed to SARS-CoV-2, you don't actually become sick from the virus.
Absolutely.
That's the goal.
There was another question, doctor. If you get the vaccination, are you actually shedding the disease after you get it?
So I've heard of some people who actually were unlucky enough to have, because again, we're only talking about people who work in healthcare and people who are in a nursing home or 75 and older right now. Those are the only ones who've been eligible to get the vaccine. Some unlucky people, and it's true with every vaccine, were already either infected or just not had symptoms, because we don't test you before we give you the vaccine. That's not a part of the norm. And so it takes so much time for your body to mount an immune response. So day one of you getting the shot doesn't mean that in that time period you still could get COVID, right? And so some people have said, I got COVID, but they were already going to get it. They didn't get it from the vaccine because there's no live virus in the vaccine.
No live virus. And I'm gonna go with another question here. After getting your vaccination 1 and 2, am I still going to have to wear a mask and social distance?
Correct.
Absolutely.
Yes.
You will.
So what's happening again is you are being protected from not contracting SARS-CoV-2. You can actually get it. However, what happens is, again, when you get that virus, when you're exposed to that virus, your body now has the information to fight it off and protect you from getting sick from it. That doesn't mean that you didn't actually get exposed to it.
And it doesn't protect you from transmission of the virus to someone else. Yeah. So if you get the vaccinations and your body has an immune response that can fight off the virus and keep you from really getting sick, you can still have the flu, for example, but you can still have COVID and transmit that to your grandmother, your grandfather, to your children. So make sure, even after your vaccination, you're wearing your mask and you're social distancing.
Because what's happening is, until we are able to get to a point, as we are with other vaccinations, that everybody can get it, we still are only protecting the person who got the vaccination. I don't know how many times I can say that. If you are in a room of 10 people and you're the only one who's vaccinated, you are still only protecting at that point yourself from getting sick. However, if you currently have been exposed to the virus, and talking about the new strains that we've been hearing about in the news, that new strain actually has been shown to be more transmissible, which means that, say for instance, I get exposed to SARS-CoV-2, right? When I get exposed to it, it actually is more virus in me. So when I'm talking and sneezing and coughing, that actually is more transmissible. It's easier to give to other people than it has been in the past. And one of the reasons that is happening is, we talk about mutation. By definition, viruses mutate, which gets to why a cure is impossible almost for most viruses, because they are smart. Any kind of exposure they have to any kind of treatments that you try, they're like, got it. The same way we're working on our playbook, they're doing the same thing. Yeah. They're trying to survive. Their goal, viruses' goals are to survive. Absolutely. And so they mutate to survive. But your body is super smart too. And that's why we're kind of in science, we're working against nature. We're always fighting some kind of infection. 1918, the pandemic, the flu pandemic. This is just 100 years later when we calling it something else.
Absolutely.
It happens normally.
Absolutely.
It's just constantly we're fighting against.
If you think about most
infection.
viruses, though, we have not found cures for. Herpes is a virus. Chickenpox is a virus. HIV is a virus. So there viruses, hepatitis,
common cold
is a virus, the common cold is a virus. So we have not yet conquered viruses.
We just get all
we're trying to control them.
We just get vaccines.
Absolutely.
That's the normal outcome.
Now this was a great question, Contessa, and I had to really dig deep into my doctor process to try and answer this question because the truth is we don't know the answers to COVID.
For sure.
So does this vaccine cause infertility issues? And I really had to sit down as an OBGYN board certified to say, let me think that through. One, the messenger RNA has not had the ability to enter into the cells.
Right.
So I started thinking, okay, your follicles, your eggs is a cell. It's a follicle. I don't know that this messenger RNA can go in and enter into and incorporate itself, because it cannot incorporate itself into your own DNA.
Yeah, for sure.
So it can't, and it just doesn't make scientific sense that it should be able to cause infertility issues. I'm going to qualify. There are lots of medicines and things that we as doctors have said, oh, it's fine, that we may in 10 years find out
not fine.
That it's not fine. And however, what we do know now is COVID is killing.
Yeah, for sure.
And so we're trying to, again, benefits and risk. And so the benefit of getting the vaccine right now outweighs the risk of infertility issues.
And I would say, if that is a significant concern, the people who maybe can make the decision to wait for a second are the younger people, especially children, because at this point, the people who are in the priority group are people who are 75 and older, and fertility is not an issue anyway. And so, and if you're thinking about actually the cool thing to me about science is, I don't know if they've particularly asked that question when they decide, I didn't get to sit in those rooms about approving the vaccine, but I would say that if you look at how they're even deciding to carry it down, like, in the priority group number 1 with the people who are elderly, right? They're past the point of fertility. And so we're trying it out if you think about it in that sense, in the group that's actually having the worst outcomes from COVID. And so we're talking about risk and benefit. And so that just, to me, gives me more confidence in science. They're not saying let's try it out in kids. They're not saying that let's try it out in 20 and 30-year-olds.
Right.
They're saying the people who are dying at a significant rate, those are the ones, kind of like going back to the breast cancer idea that you talked about. If I have kind of triple negative breast cancer and I'm at really high risk of dying, then this is better than that, right? And the vaccine for people who are elderly is better than the risk of dying from COVID.
Absolutely. And everything I do in my life, I'm going to be honest, I sit down and I weigh risk, benefits, and indication. Why am I doing this? Why am I going to this party in the middle of a pandemic? Why am I? Yeah, you really do have to sit down and everything you do and say, because again, people don't realize buying a car has a risk and a benefit.
That's right.
I got to get to work, so I need a car.
But you don't need a Bentley if you don't have any money to make.
You gotta go there.
One day it gets you there too.
Right. You're supposed to get 2 shots. Are you done with that after you get those 2 shots? That's a great question.
Yeah, they're still figuring that out. Long-term data is not yet available.
Yeah. Now we know with flu, you're not done. You get a flu shot every year.
Yeah.
Because that virus is smart. Influenza A is smart enough to know that it is A. Right?
Yeah, and A and B.
A and
so,
B.
Yeah,
yes.
so they call, and it's normal for the viruses to mutate, and they call it drift and shift. The way that the virus mutates, it may mutate just a little bit, or it may vastly mutate, enough for us to have to get a new vaccine. At this point, the mutations that have been shown to have happened in SARS-CoV-2 are not such that the vaccine, which is actually targeted on that spike protein, is still working. It's not affecting that.
Right. Can the vaccine affect a woman who is pregnant? And if any effects, can you pass it to your baby? The one thing I did read, and again, I'm reading.
But this is your skill set.
Yes,
So people who are saying as an OB, you
right.
can't answer that. Not this question.
Right. Is that they did have women during the trials get pregnant while they had, right after getting the vaccine or during the time that they got vaccine, and those women and those babies have been shown to be okay.
Just fine.
So I would have to say benefit and risk again. Now, a baby is a precious thing, including Layla.
Yes, for sure.
Okay.
Don't be talking about my poor little baby. She is special. She is a genius.
She's so
unique.
sweet.
Yes, she is. They made only one of her.
Now, what we know now is from what I've read, you can get the vaccine, but pregnant women are so far down on that list that you don't have to get so consumed with it. Now, if you got the vaccine, you're a healthcare worker, and you found out you were pregnant, they've shown in those studies that those women have been okay. And I don't know if they've actually had babies because the trial has not been
finished
40 weeks yet.
Yeah, for sure.
So again, you're not going to get the shot too soon if you're a pregnant woman because you're far on the list.
Yeah.
But do have that conversation with your OBGYN should it not be me. Key considerations in pregnant patients, though, is the immune response in a pregnant woman is lowered during pregnancy. So if you did come in contact with COVID, your susceptibility is greater as a pregnant woman. Can you address the survivors of breast cancer? And I was a little confused because it said survivor. So I'm assuming that you have already conquered the disease process and you've been given a okay. So I would say yes, certainly for those of us, because your 5-year remission period is over. Why not? Definitely. If you are taking chemo or undergoing chemo, there's so many different caveats with that. I would say make sure you talk to your oncologist to see if you are okay taking it, because we don't know the answer to that, but you are definitely immunocompromised if you're getting chemo. I'm an RN and I took the vaccine, and with a few days I tested positive for COVID. But you dealt with that.
She was already exposed, and again, this vaccine does not mean that you don't test positive for the SARS-CoV-2, which is what we're testing people for COVID. We're actually testing you for the virus.
Yes.
And so COVID is the disease that we're afraid of. And so in 2 days you haven't mounted the immune response. And so unfortunately she was one of those people who was too late.
But listen to the rest of this person's question, because we want to address it. Is that the expectation after getting the vaccine, or did I pull the short straw?
She pulled the short straw in the sense of the fact that if she already got sick, like if we're talking about her being symptomatic and she was having symptoms, because it takes a while. So when you get vaccinated, it's not that your body day one protects you and mounts the immune response. It takes some time. 4 to 6 weeks typically is what they say, right? That's when they're kind of testing for that immune response. And so day one, it's kind of, because we get people like that with the flu. They come in for their flu shot, and then the next day they tested positive, and they were already they already been exposed.
Exactly.
So,
and this is a great question.
And it's in the community. That's the problem. It's so, now we're looking at how many million new cases a day. I mean, at this point, it's so out of control that the odds are, whether you work in healthcare or whether you're that person who allows people to come over, you don't go anywhere, but you let people come over.
Right.
Then you are at the point now where it's so common in the community that the odds are you're going to very likely get exposed relatively soon.
I keep the COVID testing company on speed dial. So if you come in to stay in my house for an extended period of time, you got a COVID. I pay for it.
Come on.
But you got a COVID test.
Right here. Your
you
girl.
COVID test in your own
I mean,
office, okay? We both have
we both
have the COVID test, okay?
No.
So she always, this is
I told you at the beginning of
this is
my career.
This is bruh man from the Martin
No
show.
less than 5-6 jobs. That's just how
this is bruh man. Then there was a question that we're going to stop and deal with.
Okay.
Why are Black people all of a sudden a priority for the vaccine? Take it.
I, as a healthcare provider in a minority, I must address the fact that unfortunately we are not a priority for the vaccine at all. I think the priority is for humans to get vaccinated. And unfortunately, Africa in particular is complaining so loudly about the fact that they're being left out of this whole conversation about access to the vaccine. Native Americans, reservations in particular, on American soil, they're being pummeled by COVID. They said all the ancestors, all the people, the medicine men, the elderly people in their community are dying at an astronomical rate because of COVID. And so what's happening is, I think there has been some belief that Black people in particular are being targeted, or that we're being, contacted to be the first line. But we've been talking about this priority group, and we're not the priority group. It's not like Black, that's not category 1B. Category 1B are healthcare providers and elderly people over 75. There is no race that's on the priority group. There is no access that will happen due to your race. That actually, unfortunately, is not true. And I'm gonna tell you what really blew my mind when I even think about that whole discussion. I say, looking at my alma mater, Xavier University of Louisiana, and my other alma mater, Meharry Medical College, two historically Black colleges who are involved in the vaccine trials. They've been involved in the development of this technology and the science. And the reason that these HBCUs, in addition to my alma maters, is because we've been historically, when it comes to medical care, treatments, disease inclusion, we are being left out of the conversation. The fear that we have as African Americans about being experimented on is based on the history that we've had. Tuskegee experiment in particular, which was run by the government, that's real, that happened. But right now, in 2020 and 2021 now, in SARS-CoV-2 and COVID, Black people are being disproportionately affected by this disease.
2.7 times more likely to die from COVID than any other race.
But we don't get priority in getting the vaccine. That's not happening.
I'm going to add to what Dr. Contessa is saying. They tend to showcase Black people getting it because we are more skeptical about getting it than anybody else. So that's why they showed you the Black nurse who got it.
And Black doctors.
And that's why they're showing you Black doctors who are getting the shots. And that's why they showed you our wonderful Vice President-elect, Kamala Harris, let me get it straight, from, and I don't ever want to mess your name up. I love you, Sarah, And so
say it again. Just say Kamala Harris again.
Kamala Harris.
Yes.
I think that they needed to show us that they are vaccinating Black people who are not dying from it or coming up with some strange illness. Now I'm going to close because we could go all day with conversations with Contessa because the girl can talk.
Did she see why I called it that?
Yes. And
she talks more than me.
Yeah,
you see how people always can see the splinter in your eye.
She didn't read the word. The speck in my eye. But I so enjoy talking to you because you are so knowledgeable. And again, I chose you. Because again, they don't realize you do a lot of reading. She reads a lot. She's gotten her master's in public health. You're doing preventive medicine.
Yeah. Now integrative medicine as well.
Yes.
And I believe in alternative medicine.
Yeah.
I totally believe that food is medicine, and the least amount of medications and interventions that you can take, if you live a clean, healthy life.
Yep, that's the key.
That's the
key is to live healthy. And I'm going to see if Dr. Contessa would share with you guys, and I'll put it somewhere in this, the list of supplements that you should be taking right now to help your immune system fight off the vaccine, because they do have a list, and